In Part 6 of Module 11 on entitlements, we'll discuss Medicaid. Medicaid is a national state cooperative health care plan designed to serve the medical service needs of low-income individuals and families. Standards commonly associated with eligibility for the Medicaid entitlement benefits include the following: families who meet state's AFDC or TANF, Temporary Assistance for Needy Families, eligibility requirements in effect on July 16, 1996. Pregnant women and children under age 6 whose family income is at or below 133% of the federal poverty level. Children ages 6 to 19 with family income up to 100% of the federal poverty level. Caretakers, relatives, or legal guardians who take care of children under age 18 or 19 if still in high school. Supplementary Security Income recipients, SSI, who meet certain requirements. Individuals and couples who are living in medical situations and who have monthly income of up to 300% of the SSI income standard. In addition to these standards, states can establish their own eligibility requirements. Individuals who qualify for Medicaid receive hospitalization, insurance, and drug benefits like those received by Medicare recipients. Medicaid is a very important program with respect to advancing sustainable states and local communities. Without the benefits provided under the Medicaid program, a great many low-income individuals would have extremely limited access to health care. In many cases, low-income individuals are the virtual backbone of a sustainable community, working in low-salary jobs in the agricultural, service, and production industries. Increasingly, private sector employers are eliminating employer-provided health care benefits for their workers, leaving low-income workers and their families in a highly vulnerable position. Without access to health care, worker absenteeism tends to be high and productivity low. Undiagnosed illnesses, which could be treated inexpensively, frequently become acute and require extremely expensive emergency treatment and hospitalization. Poor access to health care for children has a depressing effect on their school attendance and learning. Sustainable communities will require high levels of employee productivity and the production of high-quality goods and services, and they will require that children are making adequate progress in their education. Healthcare entitlement programs such as Medicaid represent a critically important societal commitment to low-income individuals and the sustainability of the local communities in which they live and work. The Medicaid program is a quintessential illustration of how the social safety net connects to the promotion of sustainability. While clearly a direct benefit to the promotion of sustainable communities and the low-income individuals who need attention to health care concerns, Medicaid is a substantial and growing financial burden on state government. According to Medicare.gov in 2018, 73,355,220 individuals were enrolled in Medicaid and the Children's Health Insurance Program in the 50 states and the District of Columbia, reporting June 2018 data. Nearly 67 million individuals were enrolled in Medicaid, and 6.5 million individuals were enrolled in the Child Health Insurance Program. More than 15.7 million additional individuals were enrolled in the Medicaid and CHIP program in June 2018, as compared to the period prior to the start of the first marketplace open enrollment period, July to September 2013, in the 48 states and the District of Columbia that reported relevant data for both periods, representing nearly a 28% increase over the baseline period. Connecticut and Maine are not included because they did not report data for both periods. More than 35.4 million individuals are enrolled in the Child Health Care Insurance Program, or are children enrolled in the Medicaid program in the 48 states that reported child enrollment data for June 2018. Children enrolled in the Medicaid program and individuals enrolled in the Child Health Care Insurance Program make up over 50.6% of total Medicaid and Child Health Care Insurance Program enrollment. Community health centers are among another important tool in developing sustainable community health programs. The health centers are particularly important in rural communities which lack readily accessible hospital facilities. In smaller communities, local hospitals are acquiring the role of community health centers, not only providing the hospital bed and surgical services, but also conducting active health promotion campaigns of many types that promote prevention and early detection of illness. Community health centers serve as important cost-effective hubs for preventative health care services such as child immunization services and health screening, health education classes for both the young and the elderly, and drug and alcohol dependency programming. Community health centers might also help to overcome current inequities in Medicaid patient care delivered by private commercial providers, and might also be a long-term solution for the need to combine health and public assistance benefits with daycare for working mothers and unfulfilled need. In Part 7 of Module 11 on entitlements, we'll discuss State Children's Health Insurance Program, or SCHIP.